Hello and welcome back. This is part 2 of Unit 10 UGC NET JRF Forensic Science. In this part, we will discuss about post-mortem examination, changes, estimation of time since death. Starting with the post-mortem changes, skin becomes pale within 15 minutes after death. So this is known as pallor mortis, as there is no supply of fresh oxygen. So the skin will become pale in color. Livor mortis, hypostasis or death color. So due to the depletion of oxygen, hemoglobin turns purple and blood will come out of the cells into the body. This process is known as lividity. So there is a layer of purple, bluish purple color that you can see. So here in this picture you can see the bluish purple coloration. This is due to the lividity. Lividity or sigillation begins about after 2 hours of death and it will become permanent after 8 hours. And if the temperature is high, lividity will start earlier. Lividity gives us the indication of time of death. If it just started, so it will be about 2 hours after death, and if it is permanent, so 8 hours after death. So along with the time, it also tells us about the position of the corpse. So as the gravity pulls down the blood towards the ground, so this blood will be accumulated on the surface or the area touching the ground. So this is known as area of contact fluttering. Ground, it may be ground or bed or chair, anything. Dual lividity or lividity at two positions is observed in cases when after 2 hours of death the body is moved to a second position. Glove and stocking pattern of lividity is observed in drowning cases. Another one is rigor mortis or death stiffness. In this is caused due to accumulation of extra calcium in the muscle tissues. So first, the muscle fibers remain contracted, then they begin to relax, and after that, the muscle fiber begin to dissolve by autolysis. Rigor mortis is also known as death stiffness or muscle stiffness. It starts within 2 hours after death. The stiffness first starts in the head region and moves towards the legs. After 12 hours, the body is at its most rigid state. Then, during 15 to 36 hours, the muscles start relaxing. So, the rigor will be lost in the same pattern as it was started. It would first be lost in the head and neck region and then in the other parts. The stiffness or the rigor mortis completely disappears after 36 hours of death. So this also helps in determining the time of death. The factors affecting rigor mortis are high temperature increase the rate of rigor mortis, fat composition or weight of the person also plays a major role as fatty tissues store more oxygen. So rigor mortis would be slowed down in heavy persons. And if the level of physical activity is high, so the level of oxygen in the body is already high, already low. So the rigor mortis would be earlier. Cadaveric spasm, post-mortem spasm, instantaneous rigor, cataleptic rigidity or instantaneous rigidity. It occurs when the cells are functioning very rapidly just before death. As in case of drowning, if If the person is holding on to some grass or some stone, its finger become stiff. So this type of process is known as cadaveric spasm. It occurs instantly. Primary relaxation is not observed. Muscle relaxation is alkaline. Now the Niston's law for rigor mortis onset. So rigor mortis will appear first in the involuntary muscles and then in the voluntary muscles. Involuntary muscles that are not controlled by us, voluntary controlled by us. So the body part heart, rigor mortis onset would be within 1 hour, eyelid 3 to 5 hours, jaw and facial muscles 4 to 5 hours, neck and thorax 5 to 7, upper limb 7 to 9, abdomen and lower limb 9 to 11, small muscle of finger or toe 11 to 12. So as you can see here in this picture, the hand of the dead person is hanging because it is stiff. So this shows rigor mortis or death stiffness. Now algor mortis or death heat. So cooling down of the body. So approx 1 hour after death, the body cools at a rate of 0.78 degrees Celsius or 1.4 degree Fahrenheit, 1.4 Fahrenheit per hour. After the first 12 hours, the body loses about 0.39 degrees Celsius or zero point 0.7 Fahrenheit per hour until the body reaches the same temperature as that of the surroundings. जैसे ऐसे बोलते हैं ना बॉडी ठंडी पड़ गई है, so that is algor mortis, and the rate of algor mortis up to 12 hours is 0.78 degrees Celsius, and then after 12 hours it is 0.39 degrees Celsius, or and when the body reaches the same temperature as that of the surrounding, the cooling of the body will stop. High temperature will slow down algor mortis. The shape of cooling curve pattern of a human cadaver is sigmoid. As you can see, till the first 12 hours it is increasing, then it is increasing a little less, and then it will become constant. So the four mortis that we have studied are pallor, liver, rigor and algor mortis. Now the stomach and intestinal contents, they also give an indication about the time of death. So stomach have time of digestion up to 4 to 6 hours, small intestine 12 hours and large intestine 24 hours. And the time of death after meal, if the time of death is 0 to 2 hours, so the undigested food is present in the stomach. If it is 4 to 6 hours, food will be present in the small intestine. If it is 12 or more hours, food will be present in the large intestine. The changes in the eye. So the surface of eye will get dried and there is a thin film within 2-3 hours after death if the eyes are open, and if the eyes are closed, the thin film will be observed within 24 hours after death. Potassium will start accumulating inside the vitreous humor, and potassia are found in around the eyes, the lining of the mouth and the throat. These are also known as Tardieu spots, and these are the pinpoint hemorrhages, reddish purple in color. Now the stages of decomposition, initial decay. In this the corpse appear normal from the outside, but two actions start taking place, that are autolysis and putrefaction. The processes starts taking place. Second stage is putrefaction. Order of decaying flesh, and the corpse will appear swollen. This is due to the microbacterial activity. Black putrefaction, very strong odor. Parts of flesh will appear black, gases will escape and the corpse collapse. Butyric fermentation, corpse will begin to dry. Most of the flesh will be gone. Dry decay, corpse is almost dry. Further decay in the corpse is slow because there is a lack of moisture. Greenish discoloration of right iliac fossa is the earliest putrefactive change, and honeycomb liver is seen in putrefaction. The various decomposition stages in this fresh decay, the body appears normal from the outside and the autolysis and putrefaction begins. The bloated one, as of the result of putrefaction and autolysis, the gases would start accumulating in the body and the body will bloat. Active decay, when the gases start escaping out and the flesh will start to uh, go. Advanced decay, the dry part is the flesh is almost gone and only the dry part is there. Factors affecting rate of decomposition are sick individual, young. If the individual is sick, so decomposition would be earlier. If the person is young, decomposition will be slow. Overweight people, decomposition high. Naked bodies, high decomposition. Temperature range between 21 to 37 is most favorable. Moist environment, the rate of decomposition would be high. Bodies in air rather than water decomposes more quickly. The various microbes that facilitate putrefaction are Clostridium wilchi, Staphylococcus, Streptococcus, diphtheroid, and Proteus. Blowflies are attracted Blowflies are attracted to two gases of decomposition that are putrescine and cadaverine. Wasp, beetles, and mites also grow near the corpse. They take the nutrition from the dead body. Brain is the first organ to putrefy, whereas uterus is the last organ to putrefy in females and prostate is the last organ to putrefy in males. The effect of moisture on putrefaction. So if there is normal moisture, it will lead to putrefaction. If the moisture is more, there will be adipocere. If the moisture is less, there will be mummification. Casper's dictum, so it states that the time taken for same amount of putrefaction in air, water and earth are different. It is in the ratio 1 is to 2 is to 8. So that the putrefaction will be faster in air as compared to that of water and earth. Adipocere, corpse wax, grave wax, mortuary wax. It is a crumble, water insoluble, grayish white to brown wax-like material. It is produced by the breakdown of body fats into fatty acids, mainly oleic, palmitic, and stearic acid is observed. Mummification, in which the skin becomes brittle, contracted, dried, firm, leather tough, shrunken, wrinkled, and turn from yellow-brown to black in color. Appearance in cadaver. So the first will be cooling, then rigor, then marbling, and then mummification. Marbling is the linear branching pattern of blood vessels. It is due to the decomposition of hemoglobin to sulfhemoglobin and it turns the hemoglobin into greenish or reddish brown color. So the blood vessel color would be greenish and reddish brown. The sequence of post-mortem changes are primary flaccidity, rigor mortis, secondary flaccidity and marbling. Process of analysis. Virchow method, in which the internal organs are removed for the analysis and examination. Exhumation is the process to dug up or removal of body from the grave. There is no time limit for exhumation in India. Embalming is the process to preserve the body by chemically treating the dead body using preservatives such as formaldehyde or formalin. Accumulated degree hours. It is done with the help of analysis of age of insects grown near the corpse. Now, some important information related to fetus. Hydrostatic test, flotation test, Rigert test or Dosimecia test. It is done to know whether the child was born dead or born alive and then died. So if the child was born alive, it depends. This test depends on the specific gravity of lung, and if the piece of lung was placed in water and the lung will float, it indicates that the child has taken a breath. So it is an indication of a live birth. Spalding sign, it is the overlapping of fetal skull bones. These are caused by the collapse of fetal brain. It happens after a week in utero. After the fetus die and the fetus died in utero and a week is spent. So this kind of situation happens. Hassay's rule to estimate the age of fetus from its length. First 3 to 5 months, square root of length of fetus in centimeter. After 5 months, the age would be 1 by 5 into length of fetus in centimeter. The length of full term fetus is 50 centimeter or 19 to 20 inches. Maceration, in case the fetus is retained in uterus after death. So the degenerative changes that occur in the fetus body are known as maceration. These degenerative changes are much slower in uterus than in the open environment. A fetus becomes viable by the age of 7 months. The head injuries due to precipitate labor bruises may be seen on vertex or the top of the head. Laceration on scalp are absent. Beneke's technique is used to open the skull of infants during post-mortem. Caput succedaneum are swelling due to stagnation or accumulation of fluid between the layers of scalp and girdle of contact, that is dilated cervix or vulval rings. So these are most commonly present on the head of the newborn. So there is a fluid between the layers of the skull. Barr's technique is used to remove brain of infants during post-mortem. Browder's rule is used to ascertain the burned body surface area in children and infant. According to this, the victim's palmar surface area is equivalent to 1% of his or her body surface area. Fodry's test, again for the indication of live birth. Absolute weight of both lungs. The average weight of lungs before respiration is 30 to 40 grams and after respiration is 60 to 70 grams. So the absolute weight of both lungs were taken and it is suggested whether the fetus was born alive. If it is alive, so it will show around the weight would be around 60 to 70. If the fetus was born dead, the weight would be around 30 to 40 grams. Breslau's test again serve the same purpose. If the stomach and intestine float in the water, it indicates that the fetus was live, uh, was born live and then died. Ploquet's test, again for the same thing. The basics is lung and body weight ratio. So If there is blood flow in the lung, the ratio will change from 1 by 70 to 1 by 35. Some other signs of live birth are specific gravity of lung is 0.94, that is lighter than water, that is why lung will float. Pleura is taut and stretched. So pleura is the fluid surrounding the lung or the pleural cavity. Absolute weight of both lungs would be 70 gram, as we have already discussed in Fodry's test. Position of diaphragm is 6th or 7th rib, as before respiration it is 4th or 5th rib. Now the fetal structure and the closure period. Umbilical arteries 10 hours 3 days, left umbilical vein 3 to 5 days, Dictus enterosus 7 to 10 days, foramen ovale 2 to 3 months. Some important terms. Infanticide is the killing of infant within 12 hours of birth, and the punishment is within section 302. Feticide is the killing of fetus in the womb, that is before birth. Filicide is the killing of child by the parents. Parricide is the killing of or murdering parents or close relatives by the child. Now, gestational period after conception and the development feature. Around 6 to 8 weeks, volar pads will form. 10 to 12 weeks, volar pad begin to reside. Uh, Before hands and feet, volar pad is formed, and then hands and feet would be developed. Around 13th week, skin ridges would appear. Around 21st week, fingerprint pattern would be complete. Around 2 months, hand and feet are webbed. 4 months, sex is distinguishable externally. 6 months, eyebrows and eyelashes appear. 8 months, fingernails reach tips of the fingers. Thank you for watching. Stay tuned for more such videos on my YouTube channel Vidhi Vigyan.